strive to treat everyone as a whole person who is part of our family, part of our community, and feel that everybody deserves not just health care, but excellent care.
I am so proud to work for Santa Rosa Community Health, and I'm proud because of this work that we do, because we're able to provide non-judgmental care, and because we're able to spread more knowledge around the community.
Team Vita is a very, very special medical opportunity for patients and for clinicians alike. The services that are offered there are very comprehensive and far-reaching. They have nursing services, they have social work services, they have outreach workers, all of whom are focused on the medical needs of patients that are eligible to be seen through Team Vita. So that's a very special and specialized kind of subset of what we do at large at Santa Rosa Community Health Centers.
HIV stands for Human Immunodeficiency Virus. If left untreated, HIV can lead to the disease called AIDS, Acquired Immunodeficiency Syndrome. Although treatment and care has come a long way since the first reported case in 1981, the history of HIV and AIDS is laced with fear and stigma associated with this virus and has cost us the lives of millions. In 1994, HIV and AIDS was the #1 cause of death for all Americans ages 25 to 44. Since 1981 and through 2011, the County of Sonoma has tracked over 2,000 AIDS diagnoses, with a fatality rate of just over 55%. Since our county's peak in 1992, the number of newly diagnosed cases has declined, primarily due to better treatment of HIV, which helps to cause a delay in the conversion to AIDS. This is also due to an increase in testing rates, which helps to ensure people living with HIV are linked to life-saving care. Unfortunately, even with the tremendous amount of medical advances, HIV has become a disease of poverty, impacting communities of color the hardest. This is for many reasons, the largest being the lack of available resources. Nationally, Latinos are disproportionately affected by the HIV and AIDS epidemic. For example, while Latinos made up 16% of our national population in 2009, they made up about 20% of newly diagnosed HIV cases. With a growing Latino population in Sonoma County, it is important that we close this gap and provide the best service possible to all at risk. That's where you come in. At Santa Rosa Community Health, we are united in health, heart, and justice, and we believe that healthcare is essential to social justice. All who enter our doors are seen, heard, and valued. Science has come a long way over the past few decades with regard to HIV care and management. As few as 30 years ago, HIV was considered a death sentence and took the lives of millions. As I mentioned, this virus, when left untreated, still claims far too many lives each year. Since approximately 1 in 8 people infected with HIV in Sonoma County don't know their status, testing all patients for HIV is an incredibly important measure of quality medical care in our community. With proper care and medication, HIV is now treated as a chronic illness, and people living with HIV can live long, active lives. Not only is a positive HIV status no longer a death sentence, with a suppressed, undetectable viral load, people living with HIV can continue to enjoy the same activities as everyone else, without fear of passing the virus to those closest to them. But early detection is the key to ensure our patients receive the quality, life-extending health care they deserve. Again, approximately 1 in 8 people living with HIV do not know their status. That is why we test all patients 15 and older, regardless of their sexual history, age, race, gender, etc. This training video provides an overview of services provided at Santa Rosa Community Health, including education on life-extending and preventative treatments, and how you can do your part to stop the spread of HIV in our community. You will get both technical and support tips to prepare you for a wide range of scenarios. At Santa Rosa Community Health, we follow CDC and USTP guidelines and provide opt-out testing at all clinical sites. This means that all patients, 15 and older, are tested for HIV regardless of their history, age, or gender, unless they actively opt out of the test. Opt-out testing is fully and seamlessly integrated into clinic workflows through our eClinicalWorks database system. And we're counting on you to actively intervene and inform patients that we test everyone for HIV.